Another day, another health crisis.
Crisis. The most overused 6 letters in the English language. But if you flick through the problems at Perth's Sir Charles Gairdner Hospital at the moment, it's hard not to use that word. We're used to ambulance ramping and bed blocking, cancelled surgeries, stretched waiting lists. That's just the cost of doing business in a modern hospital.
It's way too much.
It's just too much.
But on top of that, we've just found out that at Charlie's, we've got problems with overflowing sewage.
Oh my God!
Fungus growing from ceilings.
Long fibres like wires, some of them stretching over a mile.
Defective water pipes. And even a radiation scare.
I bring you love.
How did it get to this?
This current crisis is a hangover from decisions made a full 8 years ago. And as you can see from the headlines, this is a wake up with a Mike Tyson tattoo, there's a tiger in the bathroom kind of hangover. The rot started with the election of newbie West Australian Premier and keen snack jogger Mark McGowan.
There's nothing wrong with going for a run and having a kebab.
Back in 2017, the WA economy was in the overflowing toilet and Mark had just inherited a set of books drowning in red ink. He was the new mayor of Shantytown and needed to find some savings fast, so he commissioned a report called the Sustainable Health Review. The report noted that the health portfolio was eating up an ever greater proportion of the total state budget. It was 18% in 93, but 30% by 2016. The toe cutters at Treasury had noted that it cost a bit over $6,300 to treat a patient in a WA hospital, compared with $4,700 in Victoria. The review predicted that by 2026, health would account for more than $1 in every 3 spent by the WA government.
So Mark cut spending.
Massively. In Colin Barnett's first year of office, health grew by 12% on the previous year. It had average growth of 9% a year for the previous decade. In Mark's first year in office, growth was 2%. A year later, it was down to 1.4.
Well, in health, you'd need to spend an extra 5% a year just to stand still.
At least 5. So this was a massive cut in real terms. The Australian Nursing Federation and the Medical Association all called for more money, because more money means more beds means more doctors and nurses, and more doctors and nurses means more membership fees for the ANF and the AMA.
We'll always back self-interest.
At least you know it's trying. McGowan wouldn't budge. It took a child's death for the government to loosen the purse strings.
The government has promised to overhaul WA's hospital system in honour of a little girl who died waiting for help in the emergency department.
Then Health Minister Roger Cook, seen here with all his friends, started spending.
I'm here today to announce a $99.5 million package for the emergency department.
When not posing for the worst men's health cover in history, Roger and Mark busied themselves finding new ways to boost the health budget, not cut it. But by that time, this is 2021, a lot of damage had already been done. Anyone who owns a house knows that if you scrimp on maintenance, you're going to pay a price eventually.
Oh, and we're paying the price now.
This week, it was Health Infrastructure Minister John Kerry's turn to take a big old bite of the health shit sandwich.
It's a bit nutty.
John was in a bit of denial about the problem, saying the hospital wasn't as bad as the West Australian newspaper was making out.
Ultimately, it hasn't affected the performance of operations in the theatre.
Yeah, he's like Homer chasing that roast pig.
It's just a little slimy. It's still good. It's still good.
The Premier also decided that the best defence was a good offence.
Don't go to hospital, scaring Western Australians. Scaring Western Australians because he sees a small gap of a political opportunity here.
All very theatrical, but all we want to know, Rog, is when we can expect a first world health system.
In Western Australia?
I'm Ben Harvey.